One of the fundamental gaps of knowledge in management of people living with obesity at the moment is that we cannot really capture the clinical dimension of the disease. This includes obviously all the cardiovascular risk and the upcoming risk for cardiovascular fatal events, right? So even though obesity has evolved over the last decades to one of the leading global health issues and is an important, that's what we've learned, an independent risk factor for cardiovascular disease, current calculators, current apps for cardiovascular risk prediction do not consider the risk factor of obesity disease. Obviously, from a cardiology perspective, well, there are well-established calculators and risk apps available for the general population, which usually imply more conventional cardiovascular risk parameters. However, obesity disease itself, the population of obese people, is not captured in these risk assessments, and that's probably for good reasons, because first of all, we're still struggling with the definition of obesity beyond anthropometric measures. And BMI as an anthropometric measure, again, as we all know, is simply not good enough, is not qualified to capture the clinical dimension of the disease and more specifically the cardiovascular risk inherent of a specific person. And of course, BMI as an anthropometric measure, it says nothing about body composition, it says nothing about individual fat distribution pattern, and most importantly, it doesn't say anything about the functional integrity of the adipose tissue or dysfunction of excess adipose tissue on neighboring organs and cardiovascular structures. And that's exactly what the iPod project is about, what's the intention of the iPod project, namely to establish a novel AI-based tool to first time capture and quantify the risk of cardiovascular disease and disease progression in people, not a general population, but specifically in people living with overweight and with obesity. So another important aspect of the iPod project is to support at different levels, both patients but also healthcare providers, with the management of obesity as a very complex and heterogeneous disease. So with the iPod risk score to begin with, we will develop first time an evidence-based risk score to predict cardiovascular risk and risk progression, which has been established in this specific target population of obese people and which has been confirmed against the primary endpoint, against clinical reality, which is change in plaque progression after 24-month follow-up at cardiac imaging. Of course, we do have risk assessment tools available at the moment. However, so far input essentially has to be provided by the healthcare provider, and the output, on the other hand, is not visible for patients, and it's not easy to interpret. In contrast to that, the Citizen app makes the difference because it allows to continuously collect real-time lifestyle data and integrate these lifestyle aspects into a continuously updated risk assessment tool, thereby empowering people living with obesity to more self-confidentially, to more independently, to more reflectedly manage their own disease and, importantly, to prevent disease-related complications. So my feeling is that at this point, it is still too early to really capture the full picture of how novel AI tools may help us in the future in clinical care and what's the contribution to advanced patient care. One thing I can see for sure is that AI may definitely enhance diagnostic precision, and that specifically on personalized level. I think we can say for sure that AI tools and AI-based algorithms are clearly superior to everything we've seen before when it comes to optimizing diagnostic precision on a personalized level compared to medical routine. But also beyond diagnostic precision, we're talking about therapeutic safety. AI probably will play an important role in the future. And when we envisage, for example, wearable features or sensors and the substantial volume of data provided by those, AI machine learning tools and algorithms may definitely help when we're talking about patient monitoring. And for example, capture early beginning of upcoming complications, let's name it arrhythmias, let's name it respiratory distress, hyperglycemia, very early, and can give safety signals to patients, but also to healthcare providers. But having said that, for sure, we're facing here at the moment a regulatory gap, how to handle these big data we're generating based on AI tools. And that is something where we definitely need to find a regulatory solution in the future very urgently.